else, and I want to introduce you to Julie Moore. Julie's in our thyroid recovery program, and we just started. So what we want to do is we want to try to get a video of you so that we can kind of, follow you through your care, so people can see like what you were like, and then as you get better, then you can kind of talk about that. So why don't we start by just telling us like what's your, remember when we talked about what are your 5 things, and we did the consultation, the exam, and we were looking for all the markers, parameters, and you were, and I told you you're a candidate. So now let's talk about, where you were, before you came in. And obviously you've only had 1 treatment, so we haven't had much improvement. Just want to see where you're at now. So just kind of tell us some of the symptoms that you're having.
Okay, my main symptoms have been the weight gain, the inability to lose the weight, regardless of what I do, not being able to sleep, the really bad hot flashes that are keeping me awake every night, and the lack of energy.
Okay. Did we talk about memory?
I don't remember.
And the brain fog, and the memory
brain fog
and the concentration
is very bad at times.
So I mean, and there's not a whole lot to really talk about right now because it's just in the beginning. But I think that you can talk about the weight loss no matter what you've done, and we talked about that on some of the videos that I've done about you get to the point where you're going hardly any calories and you're trying to exercise, and then all of a sudden you're losing weight. I mean, you're gaining weight or even staying even, and that's not normal, and that has to do with, and you've experienced that.
Yes.
Okay, so what about the sleep? Talk to us, because there's different. If you have trouble going to sleep, that's one thing. If you go to sleep but then you wake up in the middle of the night, that can be 2 different things. If you can sleep all night but then you wake up in the morning and you're just as tired as when you went to bed, that's another area too that we have to look at. So what was your sleep like?
All 3 of those,
okay, all right.
Actually. I have a hard time falling asleep.
Okay.
I take a supplement that helps me fall asleep, but then I still wake up with the hot flashes only at night most of the time.
Yeah.
Seldom are they during the day, but mostly at night. And then when I do wake up for the day, I'm usually still tired, and it takes me till the late afternoon before I feel awake.
Okay. Do you have a headache during the day too?
I don't have headaches.
Okay. All right. Good. Okay. All right. And so what about stomach? And I mean, there a lot of the patients, they say that they have stomach and they stomach problems, and so they almost don't want to eat, because when they eat they start to not feel as good. It starts to bother them. They get acid stomach, or their stomach bloats out, or they have reflux, or they get tired after they eat. Do you have any of those symptoms?
I do not have pain or discomfort or any gastro type problems, but I seldom get hungry.
Okay.
And I seldom eat.
Okay.
But I still can't lose the weight.
Yeah.
So.
Okay.
Yeah.
So if you do eat, do you ever get tired like after you eat, like when you eat?
If I eat
like
something,
certain foods, right?
Sort of, but sometimes it bothers me, sometimes it doesn't. So,
Okay.
But I've been on a nearly gluten-free diet for about 9 months as it is. So.
Okay. Yeah. So
anytime I get off of it, I feel
that's
really,
what I'm talking
really
about.
bad.
Yeah. Okay.
Yeah.
But just going the gluten-free diet didn't solve your problems. And you've been to a lot of different doctors. You can kind of maybe talk a little bit about that too.
I've been to a naturopathic doctor to treat the thyroid, and it did help somewhat for at least the first 5 or 6 weeks. Put me on a whole, several other supplements as well. And then a separate doctor, chiropractor, who is skilled at treating adrenal insufficiency, and he's the one who put me on the adrenal reset diet.
Okay.
And things have been a little bit better, but that's been about 18 months. Yeah, about 18 months. And I feel about 40 to 50% better than I did when I started 18 months ago.
Okay.
But I've stopped.
Yeah.
I've stopped
so
getting
40,
better.
50%, and the 18 months, and then you just kind of, and haven't improved anymore.
No, actually,
Okay.
I've gotten worse in the
Okay.
past 3 months.
Okay. All right.
So.
Okay. So all right. So then we did the labs, and we're waiting to get those back on you. So what about as far as the hot flash and stuff? So you're not getting them during the day, you only get them at night, right?
Most generally at night. If I get kind of stressed out or panicky, I start having a hot flash during the day. But most of the time, it's just at night.
Okay.
And
So
my blood sugar, it seems to be related to my blood sugar.
Yeah, it usually is. Okay. So then there are times when that when you get stressed, that your anxiety kicks in because you have anxiety, you have the heart palpitations.
I have not
Okay.
consistently, but I
Yeah,
have
yeah,
had that
okay, right.
under a
Yeah.
lot of anxiety.
All right. So that's all, and that's after 18 months, and you actually had it longer than that. You just been under treatment for 18 months. Yeah.
Right.
So anyway, all right. So we've just she just started. We did the history. We did the neurological exam, and some of the things that's a little bit different too is we do the functional medicine, but we do the functional neurology. So we did a lot of neurological testing, and then we talked about Dr. Karazian's book and you had heard of that, but you'd never looked at it. But you've done a lot of other research on your own trying to figure this out because no one's been able to help you. And then we found things neurologically, so we're starting with the oxygen and doing that. And we're just waiting now for your labs to come back. So we'll check in with you in about 2 or 3 more months to see where you're at, and then we'll update your video. Do you have anything else you need to add or say? I think you did a pretty good job.
I can't think of anything else.
Okay, all right. So we'll check back in with her. If you have anybody that you know of that's having some thyroid problems, they've been to other doctors and they haven't gotten any better, then share this video with them. If you want to make any comments, we'll reply to the comments. And also, you can go to, if you want to get more information and a report on how we're going to take care of Julie, you can go to tulsathyroidrelief.com and download the report. So we'll check in with you in a couple months then.